6 visits, 60% better. I'm expecting 10 to 12 visits, 100% improvement here with her coccyx tailbone pain. Okay, so we've done a video here on Maria. She's got coccydynia, tailbone pain. We're on our 6th visit. She rented a laser and didn't do that well. We're honest, we give honest reviews here. These are real patients, not paid actors. Yes. She didn't do well, but then she came in earlier this week after taking the laser for a week without adjustments. We now are seeing her a couple times a week. I've done laser with my own lasers to make sure it's being done properly. We gave her a couple free laser treatments because she's been really gracious as far as letting us film her progress. And although we're not going to show her tailbone, that would be inappropriate. She's doing great. We're on, again, treatment. So how are you doing so far with the tailbone pain?
So much better. It's like 60% gone. I've been able to sit, which has been awesome after so many years.
You hear that? Years. So she hasn't even been able to work because she can't sit. So now 6 visits, 60% better. I'm expecting 10 to 12 visits, 100% improvement here with her coccyx tailbone pain. So we did some cold laser. We did a scan of 5 to 250 focused on tissue repairing, and we're going to adjust her for her lower back and her tailbone pain. And I'll show you some of the things we do. And this is not for every case of tailbone pain. So we've had tailbone pain where we've done Logan technique for people, different techniques, but have you put your head flat down. Go ahead, and what I'm going to have you do is just keep your legs straight and raise one leg at a time. Good. The other one. Good. What that does is it tells me what's going on with her sacrum. And the tailbone or coccyx is attached to the bottom of the sacrum. So if there's any tilt there, I can tell by that leg raise test. And she doesn't have that, but her pelvis is out. And we're going to adjust that because she does feel some tightness on this right side often with her lower back. And the leg shows up a little short here. So, I'm going to have you lay on your left side, Maria. Face me right over here. All right. So, she's been to, countless doctors, osteopaths, orthopedists.
Traumatologist.
Traumatologist?
Yeah, like orthopedic traumatologist. This was also an acronym.
Traumatologist, orthopedic traumatologist, all sorts of chiropractors, right? Physical therapists.
Physical therapy.
Acupuncture. 6 visits, 60% improvement. It's not just me, it's the cold laser therapy. I'm not going to take the credit here. That laser is a game changer. If you haven't tried it, and if somebody's doing laser on your tailbone pain and it's once a week, that's not enough. That's why you're not getting better. So that tells me that the person doing the laser doesn't know what they're doing because they're not putting you on a proper care plan so you succeed, right? The doctor's recommendations are for you to get the best results. They're not meant to make him the most money. They're meant to get you the best results possible. And that should be the real reason for a physician or a doctor, a healthcare practitioner's care plan. So once a week, it's great, but if it's not enough, you're wasting your time and your money and wasting his time as well. And you're not going to get the results needed here. And relax yourself here. Nice and gentle adjustment. Good. Okay, lay back down on your stomach, please. Okay, turn over on your back. And I'm going to have you slide down a little bit. So we've done some other videos on tailbone pain and how to fix it. And everybody wants to do exercises. And honestly, I found that if you have tailbone pain and you had trauma to it, exercises are not going to cut it. They're not going to do much. And if you did get pain relief from exercises, awesome. Keep doing them. Tuck your chin, deep breath in, and blow all the way out. Good, good. Okay, now slide up for me. Yep, okay. All right, folks, maybe when she's 100%, she'll let us do another video, yeah?
Yeah, absolutely.
Okay, so maybe in 4 to 6 more visits, we'll have her there. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.